experiences of personal therapy and supervision are enormously valuable, and at times we'll touch on these same issues. So, on the other hand, this is a very focused effort here that, there's a lot of room in those other situations to examine many other things, so that frequently the impasse may not be the focus. There's so much literature and there's so much of a needed capacity to learn how to deal with these things that I think this offers a concentration in it versus it is the be-all and end-all, and it does not negate the value of, in fact, the other experiences someone should have, and it also can enhance those experiences. I can imagine taking from an impasse discussion and going to see your therapist and talking about what you discovered in there, and that would deepen it, and one could go after more personal issues. And so those are the kinds of things that I think, certainly in therapy and supervision, helps you to open up about, well, I think I realize I now have just not this problem with one patient, but I have this with other patients. So I think it is a concentrated patient methodological approach that the instructors can provide that allow these things to grow and develop, that don't quite come out in the same, because there are different roles. The supervisor has many other things to address, as does, a teacher, for example, or a therapist. There are many other things. It isn't just impasses. However, it does occupy a piece of those exchanges. So I'm just saying, with this package, I think that someone comes out enhanced in their self-knowledge and enhanced in their ways of how to think about these things that are not necessarily the ways in which many different supervisors might work. And so I think there's a value to that is a bit different, but offers something that I think is hard to come up with. I know that there are people who have had analysis who don't handle these things well, and we all know that, and we all know that even whatever therapy we might have, there are things we don't handle well, but the opportunity to zero in and learn from it and having, sometimes we have supervisors who are eagerly available for that, but sometimes people don't, and they don't. So I'm saying that I think this is to me, this is a part of your essential education as a clinician.
That's wonderful. Thank you again. And then last question.
Yeah.